as I was saying, I had been experiencing pain in the lower part of my abdomen since January of 2025. And at first I just was like, it'll go away. You know how sometimes you get a pain and you tell yourself, like, ain't no need to go to the hospital for it. Like, it'll go away on its own. But this pain was not going anywhere. And it actually started feeling like somebody was hitting me on both sides of my hips with hammers. And I don't want nobody to think I'm like over dramatizing it, because no, that's literally what it felt like, to the point that I was like, okay, let me go ahead and schedule an appointment with my primary care doctor and see what she thinks is best, so I can get some referrals to go ahead and see some specialists, because something wasn't normal. Definitely was not normal. And we have to learn to listen to our bodies when something doesn't feel right. So yeah, I definitely made the appointment to see my doctor. And once I saw her, she gave me some referrals, and I went to go ahead and she also wanted me to have an ultrasound done of my pelvis and my abdomen, and she wanted me to have a CT scan done of my abdomen and my pelvic area. So did that, and it showed that I had a 10 centimeter fibroid, well, what appeared to be a 10 centimeter fibroid. And so after I did that, I went and I had to go and see a gastroenterologist too, y'all, because I had started having an issue with my bowels in February, where I was not having a frequent bowel movement the way that I should have. I was maybe, I want to say, using the bathroom going number 2, maybe 2 or 3 times out of the week, which is not normal, especially for me. I'm used to having at least 2-day action, every day. And so I knew something was wrong. So I had to go and see a gastroenterologist, and I had to go and have, which I had to schedule an appointment to see them, which I think I would see them in May. And I had to wait until August to have a colonoscopy done. And thank God everything came back normal from the colonoscopy, and the bowels had already corrected themselves. But in between that time of getting the other tests done, my doctor also requested additional testing because those tests showed a 10 centimeter fibroid, but they weren't 100% sure that it was a fibroid. So I had to have a biopsy done. I had to see a surgeon, and he basically had to do a biopsy when I went to go and talk to him about surgery. He did a biopsy of my uterus to make sure it wasn't uterine cancer. And so thank God the results of that came back normal. So it wasn't uterine cancer. Cancer